The U.S. Department of Health and Human Services has issued a new interim final rule to establish new protections from surprise medical bills and excessive cost sharing. The rule is called Requirements Related to Surprise Billing Part 1. It was an effort by the U.S. Department of Health and Human Services, the U.S. Department of Labor, the Treasury, and the Office of Personnel Management. And it's related to Title I of the No Surprises Act, a law that will take effect January 1st, 2022. The purpose of the rule is to implement many of those laws' requirements. And there are going to be requirements that apply to group health plans, health insurance issuers, carriers under the Federal Employers Health Benefits Program, healthcare providers and facilities, and air ambulance service providers. Here are a couple things of what the rule does. First, it bans surprise billing for emergency services. It essentially treats emergency services as in-network without requirements for prior authorization. It also bans high out-of-network cost sharing for emergency and certain non-emergency services. Patient cost sharing cannot be higher than if the services were provided by an in-network doctor. It also bans some out-of-network charges for some ancillary care, like anesthesiologists at an in-network facility in all circumstances. It also bans other out-of-network charges without advance notice and consumer consent. Healthcare providers and facilities must provide patients with plain language consumer notice, and part of that notice needs to explain that patient consent is required to receive care on an out-of-network basis before the provider can actually bill at a higher out-of-network rate. There are some key dates with this interim final rule. The final rule was published in the Federal Register July 13th, 2021. There is a public comment period. We're going to talk about more in a second on that. That public comment period is open until September 7th. Regulations on this rule are effective September 13th, and that's going to impact the law that begins, like we said, January 1st, 2022. Individuals can submit public comments on this interim final rule, and you can do that electronically. In the description below, we give you the link and the description of how to get started on submitting a comment. And again, that comment period runs until September 7th, 2021 at 5 p.m. If you want to send written comments, we give you the address of how to do that. Any comments that are submitted will be shared among the agencies: Department of Health and Human Services, Treasury and Labor, and Office of Personnel Management. In the description below, you can read the text of that interim final rule.